Memorial Day weekend is the unofficial kickoff to summer, and that means kids will be spending more time outside, including in the water. May is also National Water Safety Month. Joining us now to talk more about this is Dr. Greg Rebella, an emergency medicine physician with UW Health Kids in Madison. Good morning, Dr. Rebella. Thank you so much for joining us.
Good morning.
So tell me, how often do you see water-related injuries in kids, especially during this time of year?
Well, last year in the United States, nearly 800 children died from drownings, which is consistently the number one cause of accidental death among younger kids. And in older kids and teens, only motor vehicle crashes cause more deaths. And on top of these fatal drownings, over 6,000 children are treated in emergency departments for non-fatal, or what we used to call near drowning events. And these are children who, while they survive the submersion, may still have significant injuries, typically brain or other neurologic injuries that can impact their quality of their life. So unfortunately, drowning is all too common. And one of the great tragedies is how preventable the majority of them are.
Right, and given, how preventable these deaths are, how important is it for kids to take swimming lessons to, like you said, prevent accidents in the water?
Well, swimming lessons are extremely important. They're really what we call the first layer of protection. Studies estimate that 90% of drowning deaths in kids could be prevented with swimming lessons. So we want to make sure you introduce your kids to swimming when they're little, teach them how to become proficient at floating and swimming. And really, the younger that they learn the basics of water safety, the more effective they're going to be.
Right, and what else can parents do to keep their kids safe in the water over the summer months?
Sure, you add to these layers of protection, and some of them are physical layers, such as pools being the primary location for drowning in younger children. So, having a safety fence around the pool is important to keep toddlers from inadvertently falling in. And since no fence can replace proper supervision, vigilance is an important thing as well. It's a misconception that if a child's drowning nearby, you're going to hear something. And I don't know how many times when I'm taking care of a child in an emergency department that's been injured where the parent or the caregiver said, I just looked away for a moment. And the reality is that with drownings, they're often silent and they can occur very quickly. And also here in Wisconsin, there's actually a shortage of lifeguards. So this summer, many of the beaches are going to be swim at your own risk. So that next big layer of protection is keeping your eyes on your kids at all time. And then another layer is a literal layer, having your kids wear a life jacket that's appropriate for their weight. They're called life preservers for a reason because studies have concluded that the majority of boating accidents with fatalities could have been prevented simply by having life vests on. And then finally, learn CPR. So recall that there were over 6,000 near drowning events, and a significant number of these children survived because either a family member or a bystander had the skills necessary to immediately start CPR. So even knowing how to check a pulse and initiate chest compressions can have a huge impact on outcome.
Right, this is all incredibly important information for parents. Dr. Rebella, thank you again so much for joining us.
You're welcome.